Okay, today we will be conducting a comprehensive health assessment through the William Patterson University DSN program. My name is Ed Lasky, I'm a nursing student, and today we have our patient, initials GK, with us. GK, do you consent for the video recording? Are you willing to be video recorded so that we can go through your comprehensive health assessment? Is that okay with you?
Yes.
Okay, thank you very much. And so we will continue with the age span assignment. We're going to go through part one. We have a biographical data. Initials are GK. Town, city of residence is Garfield, correct?
Yes.
Date of birth?
June 2nd, 1953.
Okay. Okay, so we have age 71, correct?
Yes.
Male, marital status, divorced, health insurance, United Healthcare, Medicare Advantage.
Right.
Any supplemental insurance?
No.
Do you have an advance directive or living will or anything like that?
No.
Okay, and you are the source of information and you are a reliable source. Present health, illness state. Describe your current health status. You would describe your health as good, correct?
Yes.
Okay. From whom do you seek health care?
We have various doctors.
Okay, such as your primary physician, eye
Yeah.
doctor, dentist,
Yeah.
things of that nature.
Right.
When was your last complete physical examination? 10 October of 2023?
Yes.
Okay. And you normally get that done every year, correct?
Yeah.
All right. Which of the following were performed and what were the results? So we have exam, electrocardiogram was done on 5/4 of 24, results were normal. Chest x-ray, June of 2023, normal. Dental exam was May of 23, no cavities, so good results, right?
Yes.
Okay. Eye with refraction was September of 2023, so the results were good,
Right.
no changes. Ear with audiometry. That was not done, however. You had,
No.
ears were not done. Okay. All right. Colonoscopy was November of 2022,
Right.
and then the results were no polyps. Did the gastroenterologist recommend any time to go back?
5 years.
5 years, okay. So you have another 3 years.
Yeah.
Don't forget the appointment. The others do not apply. Okay, so we move on to the next one. The PSA, prostatic specific antigen, was December of 2023, and the results were 2.07. Did the doctor say that that was normal for you?
Yeah.
Okay, so normal, very good. Blood work you had done in May of 24 was normal, no concerns. HIV testing specifically was not done.
No.
There was, okay. Current medications, we go to prescriptions and over the counter. The prescriptions are on Flomax, 0.4 milligrams. That's for urination once daily.
Right.
You've taken it for 4 years and the results are good, so it's helping the urine flow. Olmestan, Olmesartan, okay, so
Yeah.
that's a blood pressure medicine.
Car. Yeah.
Benicar, okay, 20 milligrams once daily. You've been taking it for 15 years, so the effect is good, so your blood
Yeah.
pressure's under control now. Crestor, 10 milligrams cholesterol once daily for 4 years, and the results were good.
Right.
Levothyroxine, Synthroid, 50 micrograms for your thyroid once daily for 4 years with good effects.
Yes.
Okay. Test gel, Androgel, 40 milligrams for low T, frequency once daily, and that's 1 year, good results.
Right.
Okay. Over the counter, aspirin, 81 milligrams for your heart once daily for 4 years, no problems.
No.
Naproxen, 400 milligrams for pain as needed. Ibuprofen, 600 milligrams for pain as needed. Now we move into the past medical, surgical, accident, injury, allergies information, medical history. We have June of 1980, you had a surgery for varicose veins. The outcome was good.
Right.
Next, January of '96, you had a surgery for varicose veins again. Outcome was also good.
Right.
March of 2008, you had a torn meniscus, repaired, outcome was good.
Right.
Okay. So that was medical history. Move on to surgical history. June of 1980, you had strip veins
Yeah.
surgery. Outcome was good. January of '96, again strip veins. Outcome was good. March of 2008, repaired meniscus. Results were good.
Right.
Mental history, not applicable. Accident or injury history, we have May of 1964, a broken arm. Which arm was it, left or the right arm?
Left.
Okay. And so the treatment was you had a cast set, the outcome was good, the bone healed.
Yeah.
Next is allergies. Are you, and so there's no allergies to medication,
No.
correct? And then no allergies to food,
No.
and then no environmental allergies either. So
No,
just no allergies.
Spring allergies, that's it.
Okay. So me, like a seasonal allergy?
Yeah, seasonal.
Okay.
Sometimes
Do you-
a little bit.
Do you take anything for it or not so
No.
much?
No.
Okay, all right. I mean, we could put seasonal. So what do you got? Watery eyes, itchy
A
eyes,
little bit, yeah.
throat, maybe for a week or two? or-
Yeah.
Okay.
That's it.
Okay. All right. So seasonal for like 2 weeks, right?
Not as bad as they used to be.
Yeah, but not really requiring treatment. It's just
No.
subtle. Okay. Okay. Next is your blood type and RH factor. So you're A positive.
Right.
And transfusion history, no transfusions,
No.
right? Okay. We move into part 2 now. We go into the eyes. General condition of your eyes are good. Examination refraction was September of 2023. And any changes in acuity?
No.
So you do wear glasses though, and then with the glasses your vision is 20/20?
Yes.
Okay, that's appliances. Night vision. Any problems with night vision, with oncoming headlights with other cars, or just in general?
No.
Any problems? Diplopia, floaters, you said yes.
Mhm.
You have eye floaters. Any blind spots? No.
No.
Eye infections? No. Eye surgery? No. Other? No. Ears. General condition, excellent. You told me you had excellent hearing.
Yeah.
Right. And so, but the examination, you never had like a focused examination, but maybe just a basic examination when you go into the office, maybe a whisper test they might have performed,
Yeah.
just to get an idea. But no problems with your ears or hearing.
No.
Acuity, no changes, no hearing aids, no ear infections,
No.
no surgery on your ears.
No.
So, okay, so nothing else. Next is your nose and sinuses. General condition are good.
Yeah.
Your sense of smell is good.
Mhm.
Patency, no problems breathing in or out through your nose. No pain in your nose or sinuses in the front.
No.
No pain. No pain, no pressure, no drainage.
No.
Use of illicit drugs, no. Prescriptions, we've already went over. Over-the-counter drugs, we went over. Other, not applicable. Next is mouth and throat. General condition of your mouth and throat are good. Sense of taste is good. No concerns. General condition of your teeth, no problems. Caps, crowns, dentures, none. So they're in good shape.
Yeah.
Yeah, you never required anything.
Just fillings.
Okay, fillings, all right. However, the gum lines you have some receding in the gum lines. Oral hygiene is good. Dental exam was on May of 23, so I guess you would be due for
Yeah.
another one soon.
Yeah.
Tongue is in good shape. Swallowing is good. Throat infections, none. Change in voice, none. Use of tobacco periodically. How would you characterize that? Maybe once a month, once a
Yeah.
week, once a
Once
year?
a week, a little bit, yeah.
Okay. Surgeries on your mouth? Any surgery, mouth surgeries?
No.
Okay. Next is respiratory system. General condition is good. no problems breathing, your breathing pattern is easy
Yeah.
and comfortable, no issues with your breathing. The color of your lips are normal, we don't have any cyanosis, no blueness. Same thing with your nails. Your nails look healthy, normal color, no clubbing, no cyanosis. No coughing. You don't cough on a regular basis,
No.
right? Just like sputum. You're not spitting up anything,
No.
and no shortness of breath. Any shortness of breath at rest or activity,
No.
and then you don't use like a CPAP at night or anything like that for
No.
for your breathing. No lung infections in your respiratory system. No infections. No surgery.
No.
Surgery, immunizations. Are you all up to date with your immunizations? Did you get your flu shot?
Yeah.
Your yearly flu shot and pneumonia vaccine
Yeah.
every 5 years?
Right.
Okay.
Shingles.
And then all your other immunizations are up to date? There's nothing that's missing?
No.
So, okay. And, okay, next is cardiac system. General condition is good. Any palpitations or chest pain?
No.
And then we already said no breathing problems, which goes along with cardiac. No shortness of breath. You don't feel the need to sit up in order to breathe better. Like if you're lying down, you don't have any difficulty. You
No.
don't feel like you have to sit up in order to breathe better. Your skin color is good. It's all normal, even tone. No blueness, no cyanosis. Any fatigue or unusual fatigue or excessive fatigue,
No.
and no heart surgery.
No.
Okay. Next is peripheral vascular system. General condition is good. Your pulses are normal. No abnormal pulsations in your arms or legs. And your blood pressure. What is your normal baseline blood pressure with the medicine? What is it normally?
Usually like maybe 105 over 65.
Okay, so 105 over 65, and then your heart rate is
Usually, give or take around 70.
around 70. Okay. And then you're very athletic too. You take walks and stuff.
Yeah.
And, okay. We'll get into the exercise questions later, I believe. Blood pressure, okay. Any bruises in your extremities? No black and blues, no
No.
ecchymosis. Everything looks normal. Arms and legs. No swelling in your legs.
No.
Varicose veins. You did have surgery for
Yeah.
that though.
Yeah.
And then they took care of that problem, so
Right.
there was no more concern with that. Pain with exercise in your arms or legs.
No.
And then do you have any change in temperature? Does one arm maybe feel cooler than the other, or
No.
one feels warmer? Nothing of that nature. And then other not applicable. Next is the abdomen. Appetite is good.
Yeah.
For the last 24 hours, you already wrote this all down for me. Breakfast, protein shake, almond milk, oatmeal, blueberries, protein powder. Lunch was turkey sandwich, coleslaw. Supper, chicken, rice, and broccoli. Snack, walnuts, pumpkin seeds, rye crisps, cottage cheese, and yogurt. You have no food intolerance.
No.
Okay, and then your appetite is good. Swallowing is good. Recent weight changes.
No.
Bowel habits, let's see, frequency multiple times daily, consistency normal, color normal, no constipation, no diarrhea, no changes in your bowel habits,
No.
correct? Use of laxatives, no. Enemas, no. Nausea, vomiting, no. Any surgery on your stomach?
No.
No. Urinary system, general condition is good.
Oh, I did have hernias, 2 hernias.
Two hernias, okay, yeah.
I'm sorry, in 2020, one on each side, inguinal hernias.
Okay, so hernias bilaterally in 2020, and then you had them surgery repaired,
Yeah, March and then one in September.
and that was 3 of 2020.
Yeah,
And then the surgery, the result was good?
yeah.
Okay. Okay. Otherwise, urinary system condition is good. your urine, your pattern avoiding is good. I know you're on the Tamsulosin, the Flomax,
Yeah.
so that's been helping. No changes in pattern. The color is normal, light and like a light yellow,
Yeah,
right? Urine stream is good, no pain,
no,
no appliances, no incontinence. You're continent.
yeah,
No problems urinating at night frequently.
no,
Nothing like that. Urinary tract infections.
no,
No. Kidney stones.
no,
Surgery on your urinary system.
no,
Next is the musculoskeletal system. Activities, daily living. You said you're fairly active. You walk around a lot. You work out. You do daily chores and work around the house. Muscles are size is good. Shape is good. Muscle strength is good. No changes. No pain in the muscles.
right,
Skeleton, your posture is good. Bones are in good condition. No pain except for arthritis in your lower back. Sometimes have sore hands and sore shoulders due to arthritis. Fractures, you already mentioned the broken bone back in 1964. It was your left arm, correct?
yeah,
Otherwise, no deformities in your bones, and you're able to ambulate without difficulty.
right,
Joints, your range of motion is good. In your elbows, knees, all the other joints, no problem, except you do have some pain in the shoulders,
yeah,
in the right knee, lower back, and then the hands.
right,
Otherwise, your gait is normal, some stiffness in your hands, but no swelling.
no,
No appliances for your knee or anything else, no braces at this point in time, right? Right knee torn meniscus, that was in March 2008. You had the surgery to have that repaired, and then no problems ever since. The result was good, right?
yeah,
Very good. Neurologic system, handedness. So you're right-handed normally. Sensitivity to touch and temperature are normal, right? No problems with feeling hot or cold
no,
with sensation. Activities of daily living. You're able to take care of yourself. You have good ability. And no changes in that. It's been constant. You've been able to take care of yourself with no problem. Headaches, none. Mental function, reason for visit. Well, this is the comprehensive health assessment right now, but you never had to have a doctor's visit for a headache or anything. No headaches at
No.
all. Okay. Fainting spells, none. Seizures, none. Motor function, your gait is good, normal. You're steady on your feet. No concerns. Coordination is good with your arms and legs, and no weakness. No numbness, no tingling, no tremors, no tics, no paralysis, and we already discussed the locations of your pain. Speaking of the pain in your knee, lower back, and hands, the characteristic of the pain, would you consider it sharp, dull, or burning pain, or how would you describe it?
yeah, like in my sharp in my hands, but
Mhm.
the rest, just like an ache.
Like a dull ache
Dull
or
ache,
like that?
yeah.
Okay. And then the frequency, how often do you get pain in those areas?
Oh, daily.
Daily, okay. And then we already went through the medications that you take to help you out with that,
Yeah,
like the Motrin, and that's been helping.
yeah, very,
Mhm.
very, not often.
Okay. And then rating your pain on a scale of 1 to 10. If 1 was just a little bit of pain, and then 10 was like the most pain you ever had in your life,
Oh,
how would
yeah.
you rate the pain?
A 5.
A 5. Okay.
Yeah.
Are you can you tolerate the 5, or do you need the number to be lower than 5?
No, it's
How would you say?
tolerable.
5 is okay?
Used
Okay.
to it, yeah.
Okay. And then actions taken, like we said, medication. Do you apply heat to the areas or anything else, or is it just medication?
Sometimes, yeah, it's sometimes cold.
Cold. Okay.
Nice, yeah.
Does that seem to help?
Yeah,
Okay. 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 So we're talking about the neurologic system now still. So any injuries, head injuries? Do you have dizziness?
no,
Um,
no,
like no head injuries leading to mood changes or other,
No.
not applicable. Okay, next we move into breast and axilla. Size normal, shape normal, nipples normal, problems, no problems, other, not applicable. Sexuality, orientation, heterosexual, comfort with sexual preference, you said you're comfortable with it. Activity, satisfaction, performance, protection, no problems,
Right.
protection as needed. AIDS, appliance devices, none. Infertility, sterility, STDs, sexually transmitted diseases, you haven't had any issues with that?
No.
Okay. Next. Male reproductive system, scrotum, size, shape, and changes, all normal, no changes. Testes, size, shape, location, normal, no changes. Penis size, shape, meatus, normal. Foreskin circumcised. Self-examination, nothing unusual. Okay, next we move into tools and interpretations. We're going to go into spiritual, cultural, psychosocial assessment. First is spiritual, HOPE, assessment. So spiritual resources, what are your sources of hope and comfort? You said you like to read daily, you read the Bible, you believe in God, and praying is important to you. We go to O next, is organized religion. Are you a member of an organized religion? You said yes. What religious practices are important to you? Is Catholic. Personal spirituality, do you have spiritual beliefs separate from organized religion? You said yes. And then what spiritual practices are most helpful to you? Is a higher power. Effects on care. Is there any conflict between your beliefs? Any health care you may receive or be receiving? No. Do you hold beliefs or follow practices that you believe may affect your health care? You said no. Do you wish to consult with a religious spiritual leader when you are ill, making decisions about your health care? No. Next is cultural. What racial group do you identify with? Caucasian. What is your ethnic group? Polish, Russian. How closely do you identify with the ethnic group? You said very closely. What cultural group does your family identify with? And that's Polish Russian, correct?
Okay. Yeah.
What languages do you speak? English. What language is spoken in your home? You stated English. Do you need an interpreter to participate right now? No. Would you like an interpreter when you discuss health issues? No. Are there customs in your culture about talking and listening, such as the amount of distance one should maintain between individuals or making eye contact? No. How much touching is allowed during communication between you and members of other cultures? And that was not a significant factor. It's there's not much touching.
No.
It's very minimal, if any. How do members of your culture demonstrate respect for one another? You answered being nice, being respectful to one another is important. What are the most important beliefs in your culture? Does anything come to mind? Whether it's religion, it could be.
I guess,
It could be family gatherings,
Religion.
holidays.
Yeah. Oh, yeah.
It could be it could be meals.
Christmas Eve, Thanksgiving, Easter.
Next question: what does your culture believe about health? Is there anything that stands out in your mind?
Nothing in particular, no.
Next, what does your culture believe about illness or the cause of illness? Will they think it's more scientifically based, or maybe they have just maybe their own ideas
Yeah, scientifically.
scientifically?
Yeah. Medically.
What are the attitudes about healthcare in your culture? It's accepted.
Yeah.
How do members of your culture relate to healthcare professionals? Good positive attitude. What are the rules about the sex of the person who conducts a health assessment in your culture? No preference.
No.
What are the rules about exposure of body parts in your culture? None. What are the restrictions about discussing sexual relationships or family relationships in your culture? There's no restrictions, right? Everything is expressed,
Yeah.
openly talked about. Do you have a preference for your healthcare provider to be a member of your culture? No. What do members of your culture believe about mental illness? Any specific beliefs that you can recall?
No.
No. Okay. Does your culture prefer certain ways to discuss certain topics such as birth, dying, and death? You answered no. Are there topics that members of your culture would not discuss with a nurse or doctor? No. Are there rituals or practices that are performed by members of your culture when someone is ill or dying or when they die? No. Who is the head of the family in your culture? Traditionally, it would be the male?
Yeah.
Male in the
Yeah.
household or the father? Who makes decisions about healthcare?
As far as
Like,
family,
yeah,
it's the parents.
do you or members of your culture use cultural healers or remedies?
No.
You answered no. What are common remedies in your culture, if you can recall any, if any? There might not be too many.
No.
Nothing comes to mind.
No.
Okay, so we'll say NA on that one. What religion do you belong to? You already stated Catholic. Do most members of that culture belong to that religion? You said yes.
Yeah.
Does your culture or religion influence your diet? No. Are there common spiritual beliefs in your culture? You said the belief in God, reading the Bible, going to church, were all common spiritual beliefs.
Yeah.
How do those spiritual beliefs influence your healthcare, if at all? Do they?
No.
No. Okay. I think we answered that one already. It just sounds like it's
Yeah.
rephrased. But next question is: are there cultural groups in your community that provide support for you and your family?
No.
No. What supports do those groups provide? So we already said no. So that would be NA on that one. Psychosocial assessment. Who is your significant other? Not applicable. Who is included in your support system? You stated your daughters. Can I just have their initials of each of them?
Oh yeah. JK
Okay.
and LK.
Okay. Okay. All right. And then you had a good positive self concept. A positive image of yourself.
Yeah.
When you look in the mirror, you think good things. Okay, so that one is NA. Describe what you like about yourself. You describe yourself as friendly and kind and helpful. Describe what you dislike about yourself. You said procrastination. What changes would you make in yourself? I guess try to reduce the procrastination, right?
Yeah.
You come up with some ideas.
Not in everything. Just
Mhm.
you know.
In general, yeah, that's
Yeah.
more of a
It's not a
generalization.
problem.
Okay. What are your strengths? You said ambition. You like to accomplish things. You take pride in that. What are your weaknesses? Again, it's just the procrastination. Education is college, and then you said you had a BS,
Yeah.
college degree.
Yeah.
Okay. Occupation, retired. Employment, you were with Verizon from 1978 to 2019, but you're now retired. Your finances, right now you have no financial concerns, difficulties, or anything like that. How would you describe your financial situation? You said good. Have you experienced changes in your situation? No. Your interests. Describe your interests and hobbies. You said you like working out, walking, hiking, biking, and fishing.
Yeah.
So you stay fairly active. Okay. So next we're going to move into the mini mental state examination. That's MMSE for short. Okay, all right, GK. So I'm going to ask you a series of questions here. We're going to go through this one by one. Okay, so what year is it?
2024.
And what season is it?
Summer.
Okay, the date is, what's today's date?
June 13th,
Okay.
2024.
And the day of the week?
Thursday,
And the month?
June.
Okay, next, where are we right now? What state are we in?
New Jersey,
What county?
Bergen,
And what city?
Garfield.
What is the name of this room that we're sitting in right now?
Kitchen.
Very good. And then the building that we're in right now is a...
House.
Very good. Okay. Okay, so I'm going to name 3 objects. And then I'm going to ask you to name all 3. Okay, so apple, penny, watch. Can you name all 3 of those?
Yeah, apple, penny, watch.
Very good. So apple, penny, watch. Just try to remember those, okay? Next, I would like you to count backward from 100 by sevens. So if we start at 100 and we subtract 7, what would we have?
93.
If we have 93 and subtract 7, then what do we have?
86.
Correct. Okay, 86, if we subtracted 7 from 86, then what do we have?
79.
Okay. If we have 79 and subtract 7, what would we have?
72.
Correct. And if we have 72 and subtracted 7, what do we have?
65.
Very good. Next question. Earlier I told you the name of 3 things. Can you tell me what those things were?
Yeah,
The 3 things?
apple, penny, watch.
Okay, very good. Okay, if I show you 2 objects, I need you to name them for me. Okay, so what is this?
Keys.
And then what is this?
Pen.
Very good. Can you repeat this phrase? I'm going to say a phrase and I want you to repeat it. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. If you could take this piece of paper here with your right hand, hold this paper with your right hand, okay, and if you can fold it in half for me. Now I want you to take the piece of paper and just place it on the floor. Okay, very good. Now take your right index finger. Okay. I want you to touch your nose with it. Very good. And now I want you to touch your left ear with your index finger. Good. Perfect. Very good. Okay. Okay. So now I want you to write a phrase. I want you to write, close your eyes on the piece of paper. Now I want you to do what it says. Do exactly just that. Correct. Very good. Okay, now I want you to draw 2 pentagons that are overlapping.
Okay.
Okay. All right. Very good. Next is the geriatric depression scale. In the interest of time, we're going to do the short form for my assignment. I will submit the long form. We're going to go through a series of 15 questions to try to keep the video under 30 minutes. Okay, so these are a series of yes or no answers, questions that you're going to give to answer the questions. So you're going to answer yes or no. Okay, so the first one, are you basically satisfied with your life?
Yes.
Have you dropped many of your activities and interests?
No,
Do you feel that your life is empty?
no,
Do you often get bored?
no,
Are you in good spirits most of the time?
yes,
Are you afraid that something bad is going to happen to you?
no,
Do you feel happy most of the time?
yes,
Do you often feel helpless?
no,
Do you prefer to stay at home rather than going out and doing new things?
no,
Do you feel you have more problems with memory than most?
no,
Do you think it is wonderful to be alive now?
oh yeah,
Do you feel pretty worthless the way you are now?
no,
Do you feel full of energy?
yeah,
Do you feel that your situation is hopeless?
no,
Do you think that most people are better off than you?
no.
Okay, so that concludes our two screenings, the geriatric depression scale and the mini mental state exam, and we already went through the entire comprehensive health assessment. So that concludes our video, and I thank you, GK, for participating for this assignment. And that's all for now.
Okay, you're welcome.